नमस्ते वासुदेवाय धन्वन्तरये अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः।
Yogakshemam Dhanarogyam. Health is not merely the absence of diseases, but the foundation for a meaningful and fulfilling life. Charaka Samhita. நோய் பற்றி மட்டும் இல்லாமல் ஆரோக்கியத்தை பாதுகாப்பது உணவு மற்றும் வாழ்க்கை முறை, நோய் சிகிச்சை முறை, மருத்துவத்தின் கடமைகள் என ஆயுர்வேதாவின் பல்வேறு அம்சங்களை நமக்கு அழகாக விளக்கியவர் ஆச்சாரியர் சரகா. அவருடைய அறிவும் அனுபவமும் தத்துவங்களும் இன்று நம்மை வழிநடத்தி கொண்டிருக்கிறன. இப்போ யாரும் சரக சமிதா இல்லாம இல்லவே இல்லை. இந்த புனிதமான நாளில் ஆச்சாரியா சரகரின் மகத்தான பங்களிப்பை நினைவு கூர்ந்து அவர்களுடைய ஞான வாழ்க்கையை போற்றி இந்த சரக ஜெயந்தி நிகழ்ச்சியை தொடங்குவோம். அனைவருக்கும் அன்புடன் வரவேற்கிறேன். இந்த சிறப்பான நாளின் தொடக்கத்தை நம்மை அன்புடன் வரவேற்று வாழ்த்தி நடத்த வருகிறார் கன்னியாகுமரி ஜோனின் பிரசிடென்ட் டாக்டர் எஸ். ராஜபாண்டி அவர்கள். ஓவர் டு யூ சார்.
Thank you, Niranjan. Om Namo Dhanwantari. Namaskaram to one and all. It gives me immense pleasure and privilege to welcome you all to the Caraka Jayanti Commenoration 2026 organized by All India Ayurvedic Congress, Kanyakumari Zone. Here, I extend my respectful welcome to our distinguished dignitaries, Dr. Ilanchezhian, All India Ayurvedic Congress President Tamilnadu Chapter, as well as the Principal, Immanuvel Ayurveda Medical College, Nattalam, Kanyakumari. Dr. Dhanwantri S.Premvel, former President, All India Ayurvedic Congress, Tamilnadu Chapter, and Medical Director, Dhanwantri Vaidyasala, Madurai. I extend a special and heartful welcome to our beloved All India Ayurvedic Congress Adhyayana Gurus, Dr. S.N. Suresh, Chief Physician, Sri Venkataramana Vaidyasala, Karur, and Dr. S.Hariharan, Chief Physician, Viswanath Ayurveda Hospital, Senkottai. Your guidance and commitment to preserving the authentic wisdom of Ayurveda continues to inspire all of us. It is our great honor to welcome our esteemed guest speakers, Dr. Anandkatti, Professor and HOD, Department of Samhita Siddhanta, Government Ayurveda Medical College, Bangalore, Dr. SriNagesh K, Professor, HOD, Department of PG Studies in Ayurveda Samhita Siddhanta, Sri College of Ayurvedic Science and Research, Bangalore. Dr. Rekha A.R., Lecturer, Department of Samhita Siddhanta, Government Ayurveda Medical College, Nagarkoil. We are grateful that you have accepted our invitation to share your valuable knowledge on this auspicious occasion. I also warmly welcome all Ayurveda teachers, physicians, research scholars, students, member of AIAC, all executive zone members, every participant who have joined us live through YouTube from different photos.
அனைவருக்கும் வணக்கம். அனைவருக்கும் வணக்கம். Is it okay? நம்ம இன்னைக்கு ஒரு அருமையான ஒரு தினத்துல நம்ம இன்னைக்கு கூடியிருக்கோம். It's very very an auspicious day. We are celebrating the Charaka Jayanti 2026 on behalf of All India Ayurvedic Congress Tamilnadu chapter, and I sincerely thanks the Kanyakumari Zone for their continuous effort to run the Adhyayana online series. And also on this occasion, I thank the gurus of our Adhyayana series, Dr. S.Hariharan sir and S.N. Suresh sir, for your valuable time and your valuable knowledge sharing. அருமையான தருணத்துல உங்களை மனமாற நாங்க அனைத்து உறுப்பினர்கள் சார்பாகவும் we are giving our sincere thanks to you sir. சரக ஜெயந்தி அப்படிங்கிறது பாத்தீங்கன்னா நம்மளோட சரகாவோட பர்த் அனிவர்சரி நம்ம செலிப்ரேட் பண்ணிக்கிட்டு இருக்கோம். ஸோ இந்த ஒரு அருமையான தருணத்துல நம்ம வெவ்வேறு இடத்துல இருந்து நமக்கு ஸ்பீக்கர்ஸ் இன்னைக்கு வந்திருக்காங்க. ஐ தேங்க் அண்ட் ஐ வெல்கம் ಕಟ್ಟಿ ಸರ್ as well as ನಾಗೇಶ್ ಸರ್. ನಾಗೇಶ್ ಸರ್ ನಿಮ್ಮೆಲ್ಲ ನೋಡಿ ಸುಮಾರು ದಿನ ಆಯ್ತು, ಈಗ ತುಂಬಾ ಖುಷಿ ಆಯ್ತು ನಿಮ್ಮನೆಯಲ್ಲಿ ನೋಡುವಾಗ. ಸೊ ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ಯುವರ್ ಸಪೋರ್ಟ್. ಇದುವಲ್ಲ ಇನ್ನು ಸುಮಾರು ಪ್ರೋಗ್ರಾಮ್ಸ್ ನೀವು ನಮಗೆ ಕೊಡಬೇಕು. So for our Tamil Nadu state AAC members, thank you for your support sir. And also we are planning to conduct an Adhyayana physical program, an Ayur Expo and a conference on Netra Raksha 2026 on coming Saturday and Sunday at Coimbatore. Is a physical program in the name of Adhyayana series. ஸோ இந்த ப்ரோக்ராமுக்கும் நம்மளுடைய அசோசியேஷன் மெம்பர்கள் அனைவருமே தவறாம கலந்து பங்கு பெறணும் அப்படிங்கறது ஒரு தாழ்மையான வேண்டுகோள். அனைத்து ஆபீஸ் பியரர்ஸ் அதே மாதிரி அனைத்து உறுப்பினர்கள் எல்லாருமே கலந்து கொண்டு இந்த நிகழ்ச்சியை மிக சிறப்பா பண்ணி கொடுக்கணும் அப்படிங்கிற ஒரு வேண்டுகோளை கூட இந்த இடத்துல வச்சுக்கிறேன். ஸோ ஐ எம் நாட் டேக்கிங் மச் டைம். நிறைய சம்ஹிதா பத்தி நிறைய பேசுறதுக்கு ரெடியா இருக்காங்க. ஸோ ரேகா மேடம், ஸோ தேங்க்ஸ் ஃபார் யுவர் சப்போர்ட், கான்ஸ்டன்ட் சப்போர்ட். வி ஆர் எக்ஸ்பெக்டிங் மோர் சப்போர்ட் இன் ஃபியூச்சர் ஆல்சோ. So on behalf of All India Ayurveda Congress, I welcome and thank all the speakers, all the gurus, and wish you all the best and congratulations to the entire team and happy Charaka Jayanti. Thank you one and all.
Niranjan, you are not audible.
குருவின் ஞானமும் மருத்துவத்தின் அனுபவமும் ஒருங்கிணைந்த ஒரு சிறப்பான பர்சனாலிட்டி. AIAC அத்யயனா குரு, விஸ்வநாத் ஆயுர்வேதா ஹாஸ்பிட்டல், செங்கோட்டை சீஃப் பிசிஷியன் டாக்டர் S.Hariharan சார் அவர்களை கௌரவிக்க அன்புடன் வரவேற்கிறேன்.
Thank you.
Over to you, sir.
Sadasiva Samarambam Shankaracharya Madhyamam Asmad Acharya Paryandam Vande Guru Parampara. My humble pranams to all gurus. Pranams to one and all. It is a great pleasure and privilege to celebrate Charaka Jayanti on behalf of All India Ayurvedic Congress, Adhyayana movement, All India Ayurvedic Congress Tamilnadu chapter, and the South Zone in particular. I sincerely thank the organizers for giving me this great opportunity to be a part of this auspicious occasion. Like all of you, I am equally eager to listen to the enlightening sessions by our distinguished guest speakers today. As you know, Agnivesha, the foremost among the 6 disciples of Athreya, first composed the Agnivesha Tantra. This monumental work was later revised, redacted and enriched by Acharya Charaka, giving us the timeless classic known today as the Charaka Samhita. Before I conclude, I would like to offer my humble tribute to the great Acharya Charaka by reciting two slokas from the Charaka Samhita, the first one from Sutrasthana and the second one from Sharirasthana. From Sutrasthana, he says that narrates the benefits of Samshodhana Karma. Malapakam Rogaharam Balavarna Prasadanam Pitva Samshodhanam Samyat Ayusha Yujyate Chira. When taken the Samshodhana properly, if it works, it alleviates all the rogas, diseases. It provides balam, varnam, prasadam, and also ayush, longevity. This is well narrated by Charaka in Sutrasthana. And the second one, the most favorite sloka by Charaka from Sharirasthanam. In Sharirasthana, first Adhyayam, Kadida Brushiyam, Agrivesha goes on asking questions to his guru, Atreya Maharshi, when they were walking along the banks of river. It starts like this. Kadida Brushi, Purusho Dhiman, Dadabedena Vidyade. Like that, he goes on asking around 23 questions, and Atreya Maharshi replies to the Shishya, the Prathama Shishya, Agnivesha. So they, in the Sharirasthanam, the actual principles, actual essential nature of Atma, the soul, is well explained by Charaka. I don't think that we can see such an explanation by any other acharyas except in Vedanta. Nishkriyam cha swatantram cha vasinam sarvagam vibhum vadanti atmanam atmajnaha kshetraknyam sakshinam tatha, says Charaka. About the philosophical significance of Atma, the essential nature, the self is not the doer of actions but the eternal, unchanging witness of all bodily and mental activities. Though it illumines all experiences, it remains untouched by them, ever free, all pervading, and independent. This is the explanation given by Charaka in Kadida Purushayam. Everyone says that Shreshtas Charakastu Chikitside, but I love his Sharirasthanam, especially Atma Vicharam. He explains like any other acharyas. It can be compared with Vedanta. So, at this juncture, I would like to thank Dr. Rajapandi for this initiative and carrying the mission of Adhyayana very successfully. For around 70 episodes have already crossed. So, taking this opportunity, I am thanking everyone for this opportunity. Thank you.
தேங்க்யூ சார். சார், உங்களின் அறிவும் அனுபவமான பார்வையும் எங்களை சிந்தனைக்கு ஒரு புதிய பரிமாணத்தை சேர்ந்திருக்கிறது. மிக்க நன்றிங்க சார். Now, geographical consideration in Charaka Samhita. தேசம், காலம், சுற்றுச்சூழல் இவை ஆயுர்வேதாவின் மருத்துவ பார்வையில் முக்கியமான அம்சங்கள். இந்த ஜியாகிரபிக்கல் கன்சிடரேஷன் பற்றி சரக்க சம்ஹிதாவின் பார்வையை நமக்கு எடுத்துரைக்க வருகிறார் டாக்டர் ஆனந்த்கட்டி சார், டிபார்ட்மெண்ட் ஆஃப் சம்ஹிதா அண்ட் சித்தாந்தா, கவர்மெண்ட் ஆயுர்வேதா மெடிக்கல் காலேஜ், பெங்களூர். இன்று ஜியாகிரபிக்கல் கன்சிடரேஷன் இன் சரக்க சம்ஹிதா என்ற சிறப்பான தலைப்பில் பகிர்ந்து கொள்ள வரும் அவர்களை அன்புடன் வரவேற்கிறோம். ஓவர் டு யூ சார். Sorry for the interruptions.
Okay. Uh, Hello. Am I audible?
Yes, sir. You are audible, sir.
Nothing is audible from the other end. Can I get confirmation regarding if I'm audible or not?
Yes, sir. You are audible, sir.
Hello.
Yes, sir.
Hello.
Yes, sir.
Hello.
Yes, sir.
Hello.
You are audible, sir.
Hello. Very good evening to everyone. At the outset, I congratulate the organizers, especially Dr. Rajapandi, who has taken pain in organizing Yes, I guess I'm visible and audible to all of you. Uh,
Sorry for the interruptions. Sorry for the inconveniences. Now, Foundation Therapeutics, an introduction to the Chikitsa Siddhanta of Charaka Samhita. சரக்க சம்ஹிதாவின் சிகிச்சா சித்தாந்தத்தை ஆழமாக புரிந்து கொள்ள சம்ஹிதா மற்றும் சித்தாந்த துறையில் சிறந்த அகாடமிக் அனுபவமும் கொண்ட டாக்டர் ஸ்ரீ நாகேஷ் கே சார், Professor, Department of PG Studies in Ayurveda Samhita and Siddhanta, Sri College of Ayurveda Science and Research, பெங்களூரு, நம்மளோடு இணைந்து இன்று ஃபவுண்டேஷன் தெராபெட்டிக்ஸ் அண்ட் இன்ட்ரடக்ஷன் டு தி சிகிச்சா சித்தாந்தா ஆஃப் சரக்க சம்ஹிதா என்ற தலைப்பில் பகிர்ந்து கொள்ள வரும் அவர்களை அன்புடன் வரவேற்கிறேன். ஓவர் டு யூ சார்.
Thank you very much. Am I audible?
Yes, sir. You're audible, sir.
Yeah, thank you. So I wholeheartedly thank All India Ayurveda Congress, Tamilnadu chapter. I wholeheartedly thank Dr. Rajapandi for giving me this opportunity. So today,
sir,
I'm going to explain.
Me, sir. Yeah. Excuse me, sir. Sorry for the interruption, yeah. Sir. I think so. Your video is off, sir. Yeah. Thank you, sir. Thank you, sir. Yeah.
So the voice is clear?
Yes, sir. The voice is clear, sir.
Yeah, thank you. So today I'm going to explain an introduction towards the Chikitsa Siddhanta of Charaka Samhita, the foundational therapeutics. Because Chikitsa Siddhanta of Charaka Samhita is unique, and while we are reading it, we may not understand it as it is. And while applying the Chikitsa Siddhanta of Charaka Samhita in clinical practice, we get to learn so many things while application of that. Chikitsa Siddhanta of Charaka Samhita, as we all know that Charaka is known for the superiority in Chikitsa. And as we know, Nidhane Madhava Shreshtaha, Sutrasthane tu Vagbhataha, Sharire Sushrutaha, Shreshtaha, Charakastu Chikitsite. We know that the shloka from the Subhashita. So the shloka, it is not just about in indicating about the superiority. Of course, other Samhitas are also good at it, but we see the superiority of Charaka Samhita while application of the treatment. So the lineage, when we see, the Charaka Samhita was actually, it has come to the effect, or it has come to the world from through the Ayurveda Avatarana, that is Brahma, or Daksha Prajapati got it from the Brahma, Ashwini Kumara got it from the Daksha Prajapati, Indra got the Ayurveda Jnana from the Ashwini Kumara, and Bharadwaja got it from the Indra. Next step of development of the Charaka Samhita, when we see, it was a Punarasu Atreya from whom the Agnivesha received the knowledge and wrote his own Tantra, that is Agnivesha Tantra. And the Charaka, who is a Pratisamskarta, at around 200 to 300 BC. And Agnivesha's time, as we know, it is around 1000 BC, the age, the time goes back to. And Dridabala, who is a Sampuraka of Charaka Samhita, who lived around 300 to 400 AD. The structure of Charaka Samhita, as we know, it comprises of 120 chapters, consisting of the chapters as shown here. The important works on Charaka Samhita. So main commentators are Bhattar Harichandra, who is the most ancient one, the 4th century AD. Likewise, we have important commentaries like Charaka Panjika, Nirantara Padavyakya, Ayurveda Deepika, Tattva Chandrika, Jalpa Kalpataru, and Charakopaskara. The salient features of Charaka Samhita, if we see, there it is a Kaya Chikitsa Pradhana Grantha, and oldest known and acclaimed physician apart from the Ashwini Kumaras is the Charaka Samhita, Charaka, a comprehensive treatise of Ayurveda treatment, and an extensive descriptions of Panchakarma we get to learn out of it. Then modes of action of drugs are diligently explained. Then complex theories are explained. We can have a greater discussion on each theories, complex theories. By Charaka Samhita gives us an extensive view on that, and incorporated the ideas of darshanas also, and description of Sukshma Sharira is very descriptively available in Sharira Sthana of Charaka Samhita. Now coming to the topic, that is Chikitsa Siddhanta of Charaka Samhita. This much was the introduction about the Charaka Samhita in brief, and as you know most of these informations. Now coming to the Chikitsa Siddhanta of Charaka Samhita, what makes it unique in our Shastra, in our field, that Charaka, how much he contributes, we can learn from this presentation a bit. I am trying to introduce a bit of that. The Chikitsa Paribhasha, as we all know, in that it is mentioned Yabi Kriyabi Jayante Sharire Dhatava Samaha Sa Chikitsa Vikaranam Karmatad Bishajam Smutam. Here it is, there is one point to be highlighted is Sharire Dhatava Samaha. And it is not just about, the treatment is not just about till the completion of that treatment process, as well as not till the absence of the symptom. It is the dhatu samya we need to attain. Till there, the process of treatment continues, and for which it is Chaturunam Vishagadinam Shastanam Dhatu Vaikrate Pravrittir Dhatu Samyartha Chikitsetya Vidiyate. It is pravritti towards the dhatu samya also. That is called as Chikitsa. And it includes Pada Chatushtaya, inclusive of Pada Chatushtaya, which enables us to move towards the achievement of the dhatu samya. So achieving the dhatu samya concludes the treatment. It is not just about absence of the symptom or the relief from the symptom, or it is not just about the completion of the process as explained. It is not just the conclusion of the Chikitsa Sutra. It is till the Dhatu Samya we need to work on, and we need to reach till the Dhatu Samya. That is the conclusion of the treatment. The prerequisite for the examination of the disease, we need to look into that before going to the treatment. The bishop should be uninfluenced by the pre-diagnosis. So the patients come with the pre-diagnosed cases, and also patient may tell you about what disease they have and what they got previously diagnosed as, and they may bring up some of the reports also, by which we may casually get carried away and we get influenced by that previous diagnosis. We should not be doing that, as it is mentioned in Charaka Samhita Nidanasthana. Tasmat Vyathin Bishak Anupahata Sattva Buddhi Hetvadibhirbhavaihi Yathavat Anubuddhyeta. It is mentioned. And Bishak should diagnose with the uninfluenced mind and intellect. And he should look into the Nidana Panchaka and then diagnose the disease. What to see during the examination? Tasmad Vikara Pragatir Adhisthanaantaraani cha Samuthana Visheshamsha Buddhva Karma Samachareta. So we need to look into three basic factors here. Vikara Prakriti, we need to understand the nature of the disease. Adhishthanantara, the different location of the dosha, different location of the disease, and Samuthana Vishesha, special causal factor. So what exactly it is causing the disease, that also we need to look into. After analyzing these only, we must go for the chikitsa. Next one is, who are all vulnerable for the disease? न हि सर्वमनुष्याणां सन्ति सर्वे परिच्छदाः न च रोगा न बाधन्ते दरिद्रानपि दारुणाः. So no one is spared from the disease. All are equally vulnerable for the disease despite his socio-economic status, gender, and whatever it could be. So they are all vulnerable. Hence, aushadhi must be consumed by the patient as per their individual convenience also. And if the patient is good enough to bear the expenses of the treatment, it will be easier. That is what is explained in our Shastra also, that Adhya Rogi Bishagvasho. Adhya means he should be able to bear the expense, he should be able to afford the treatment. So that will help us to do the treatment better. So before the treatment, it is examination of the Ayu, where it is to be observed about how much Ayu Pramana is left out. We should always observe based on the Arishta Lakshanas explained in Indriyasthana. After that only we should elicit how much Ayu Pramana is left out. Indriyasthana is not about when the patient is going to die. It is about the Ayu Pramana. It is going to survival duration, it is going to explain. Hence, once we know the survival duration, then we have that the opportunity to treat. Now the thing is here, the duration of treatment must be shorter than the duration of survival. If duration of survival is lesser than the duration of the treatment, it is said to be the asadhya, and it is said to be the treatment is like it is unjustified, and also we should not treat such cases. Hence, treatment duration should be shorter than the survival duration. That's what is about the Ayu Pramana we must know. And we should not reveal the information about the oncoming death without being asked to the patient, and also not to reveal even when asked if the information would damage the situation. Hence, we should be taking care before going for the treatment. We should know the Ayu Pramana, then we should proceed for the treatment. And also remaining the rules and regulations with respect to the Arishta Lakshanas should be applied before proceeding for the treatment. Now coming to the component of the treatment. So we have learned that Trividam Aushadam, that is Daiva Vipasham, Yukti Vipasham, Sattva. These are not the different treatments. This is the component of the treatment. It is not the different treatments. If the patient comes with some disease with the Daiva as a dominant factor, we are doing only the Daiva Pasha, and remaining two things are ignored. That is not the treatment method at all. The chikitsa must involve these three components. It depends on what is actually a dominant factor. If Daiva is dominant, then Daiva Amsha, that Daiva Vipashraya should be the primary line of treatment. Along with that, Yukti Vipashraya and Sattvajaya should also follow along with. If there is a Yukti, that means if there is a Sharika dosha based on the Nidana Sevana and all, we should be doing the Yukti Vipashraya Chikitsa in the beginning, and Daiva Vipashraya and Sattvajaya should be the secondary. If the mental factors or emotional factors are involved, then we must handle through the Sattvajaya primarily. Yukti Vipashraya should also be given, and Daiva Vipashraya should also be given secondarily. So like that, it is a component of the treatment. It is not the different three types of treatments. So coming to the Daiva Vipashraya Chikitsa, based on the dominance of the Daiva or Purushakara. Daiva means it is Atmakrita only. That means previously we only did, previously patient only did, and based on that what he got that disease, so that will be based on his karma only. And Purushakara is the one which he is currently doing. So whatever is currently done, that becomes Daiva eventually. Hence, Daiva, if it is stronger, previously done karma is stronger, and currently what he is doing can overcome that one. That means Daive Purushakareja Sthitam Hyasya Balabalam, it is mentioned. So whichever is dominant, based on that, the treatment has to be planned. Daivam Purushakarena Durbalam Hyupahanyate, Daivena Chetrat Karma Vishishtena Upahanyate. So if there is a Daivamsha involved stronger, then we have to make that Daiva Pasya Chikitsa, which should be like, that should be the primary line of treatment, and remaining treatment should be the secondary. And in that Daiva Pasya Chikitsa, we will be doing it Purushakara. That means currently we will be doing it. So when we are doing it currently, eventually when it joins the Daiva, so by the Prabhava, it is going to cure our Daiva based Daiva based the disease what we are suffering from. So that will be cured by the Purushakara, what Daivapashya Chikitsa you are going to do. So like that, Daivapashya Chikitsa helps through the Prabhava to overcome the disease. If the component of Daiva is strong or the dominating in the formation of a disease, Daivapashya should be the primary line of treatment, as we said. So other two treatment, if we make it as a primary line of treatment, then it will be ineffective. Often we fail to recognize if it is a Daivamsha which is involved, and we try to treat it with Panchakarma or Shodhana Shamanadi Chikitsa, which may eventually look into, it will seem to be ineffective, which is actually should be made, or we have to remodify, restructure the treatment process into the Daiva Pradhana, Daiva Pasya Pradhana Chikitsa. Then Yukti Apasya can follow along with it. If only Yukti Apasya, if we do for the Daiva Pradhana situations, then definitely the Chikitsa will not be effective. Hence, Daiva Apasya is a primary line of treatment in case of Daivamsha is involved. Hence, we should have that the vision that Yad Adrishta Jananena Vyadi Pratinekam Mantradi. So when these Mantradi Daivapashya Chikitsa is performed through the Prabhava, they are going to cure the Daivamsha based the sufferings. So next is Yukti Apashya Chikitsa. If the disease is due to the Nidana Sevana, which is mentioned in our classics primarily, that is this Aharjan, Viharjan Nidana, then Sharika doshas will be precipitated, and that necessitates the Yukti Apashya Chikitsa. But anything to happen, the Daivamsha will be strong in the background, then the patient will be made to consume those Nidana. Hence, Daivapashya should be the component even in Yukti Apashya Chikitsa. Hence, we should have that comprehensive plan of treatment while administering the treatment. Even in Yukti Apashya, we must not ignore the Daivapashya Chikitsa. Sattvajaya should also always follow along with the Daiva and Yukti Apashya Chikitsa. So Sattvajaya Chikitsa, if the primary affliction is the mind, start the primary line of treatment with the Sattvajaya Chikitsa. Whereas, while doing the Sattvajaya Chikitsa, which is actually defined as Punarahitebhyo Arthebhyo Manonigraha, of course, while treating that in that Manonigraha way of Sattvajaya Chikitsa, we should not ignore Daivapashya and Yukti Apashya as well. Just like we have learnt it in this Unmada and Apasmara. There, why Panchakarma is explained, why Vamana is explained, Virechana is explained, why the Aushadas are explained. That is purely the mind related. It is not purely mind related. It involves the Sharirika Amshas also. Hence, we need to inculcate Yukti Apashya Chikitsa also while administering the Sattvajaya Chikitsa. So, but for attainment of these mind-related issues and such type of Mansika dosha afflictions also, Daivamsha will also be contributing. Hence, Daiva Apashya should also be done parallelly. Hence, all these three are the components of treatment. It is not an individual separate treatments. Irrespective of the type of disease, all three treatments should be done. And even the Sharirika and Manasika Vyadhi, similarly, Sharirika afflictions, because they are very much entangled and very much close, and they will be influencing each other. So mind and body, they are always influencing each other. Hence, in Manasika Vyadhi also, Sharirika dosha should also be treated, and in Sharika dosha, even mind also should be taken care of. Hence, both should be treated and adopted. Treatment procedure should be adopted. Which one is primary? That should be depending on the which one is the primary afflicting doshas, afflicting whether it is a manasika dominant doshas are afflicting, then manasika chikitsa should be the primary and Sharika should be the secondary. Like that, if it is Sharika, manasika should be secondary. Like that, we have to make it the plan of treatment accordingly. Now coming to the Charakokta Chikitsakrama, this is very unique because Samavai Karanas are the doshas which are actually making that roga. Without dosha, roga will not happen as we all know. So dosha becomes inevitable reason for disease. So dosha prashamana should be the primary line of treatment again. Then comes the asamavai karana, which is dosha dusha sammochana or the dushti, what we have learnt about. That is about the roga, what it is, established roga. That has to be made nivritti. Then it is the nimitta karana. We have to make nidana parivarjana, what they have been consuming. We should cut the further supply chain. Hence, we should stop the nidanas. For that, we need to identify the nidanas and then make the parivarjana. Then we should attain at the last about the dhatu samya. Now, the thing is about what these components are. This is Charakokta Chikitsa Krama, as I said. In all other areas also, even in the Jyotishya also, dosha which is actually causing the problem will be treated primarily. Then we are going for the roga as such, what it is afflicting. Then we are going to do the pushti. So that means all those graha gatis and all the sthana of the grahas which are causing some making some influence, all these are brought into that shanti. So those things are done. So in that also, in the similar pattern, it is followed. In Ayurveda, we have one more in between. Nidana Parivarjana is one more. In fact, everywhere it is applicable though. So Charakokta Chikitsa Krama in the first one, that is the dosha prashamana. For the dosha nivritti, the treatment should be customized for the specific roga. We have seen that like Sharira Janam Doshanam Kramena Promotion, like that we know that the Vata Shamaka, Pitta and Kapha Shamaka Dravyas are enlisted. Can those dravyas be used irrespective of the disease is a question. No, it is not so, because the chikitsa is customized. So roga specific chikitsa we need to do. Hence, the roga which is contributing for that disease has to be primarily targeted. That will be Vata Pitta Kapha only, of course, but that disease specific dosha causing agent should be roga causing agent, that is the dosha, should be treated. So in our explanations, in our classics, what it is explained is about the dosha nivrutti in that specific roga. It is explained in the same way. The next one, that is asamavai karana. Here also, for dosha samorchan nivrutti, it should not be increasing the involved doshas also. We are actually trying to make the roga nivrutti. We should take care about the dosha at that time. So primarily, of course, we should control the dosha. For that only we do the Shodhana Karma. So once the dosha goes out, then the remaining dosha, if it is, then that should be made Shamana. And Roga Nivritti, which is already afflicted one, that has to be treated by the Shamana. So while doing the Shamana, Roga Nivritti, at that time, we should not aggravate the dosha which has caused it, or any other dosha by that means. So we should not be aggravating the dosha. We should take care not to aggravate any dosha, and Roga Nivritti should be done at the same time. So the next one is the Nidana Parivarjana. In this phase, actually, while taking the case, we must be careful enough to take the small details, and we should elicit the Nidana's cause for it. There may be many Aharaja, Viharaja factors, of course, involved, but they may be apatya, or it may be asatmya, but it may not be causing the disease. Hence, we should be finding out what is causing the disease. So Nidana should be identified primarily, then that will be the causal factor. That has to be made parivarjana. For example, in hypertension, if we do the salt restriction, salt may not be the reason there. So some emotional factors may be the reason, but salt restriction we do. Salt restriction, you may do it as for it is not good for the hypertension, of course, but that is not a Nidana parivarjana. because salt has not caused the hypertension. Hence, restriction of salt is not a Nidana Parijana. Likewise, Nidana has to be elicited primarily, and that has to be eliminated. That is called as Nidana Parivarjana. Next is about the Dhatu Samya or the Pushti. So ultimately we need to achieve the Dhatu Samya. This is the fourth stage, in fact. So Dhatu Samya is the intention of this Charaka Samhita, as we know that Dhatu Samya Kriya Chokta Tantra Sasya Prayojanam. So Tantra Prayojana is Dhatu Samya only. And here at this moment, Dhatu Samya also should be disease specific only. A random any Dhatu Samya Kriya is not actually advised in all conditions. In our Rasayana Adhyaya, we have seen so many Rasayana Dravyas explained, Rasayana Kalpas are explained, which are specific to some disease. And that disease specific Rasayana must be given to attain the Dhatu Samya from that disease. So initially what we did was a Dosha Nivrutti, then what we did was a Roga Nivrutti, then Nidana Parivarjana also, that should happen parallelly of course, and then the Dhatu Samya or the Pushti we need to do. So these are the 4 steps we need to adopt while treating. Then coming to the next, another protocol what Charaka has explained, that is Upashaya. So Upashaya, there are 18 types of Upashaya as we all know. So Upashaya is defined as a Sukhanubandha. So when the patient is saying that he is associating with the Sukha, then that is Sukhayu, he is going to associate, he is associating progressively. That means we are on the line, or we are actually, the treatment is precise. If the patient says Sukhanubandha is not happening, then that is a time for change over of the switching over to some other treatment protocol. Hence, Anupashaya is a Sukhanubandha. So if Sukhanubandha is not associated, that indicates we must change the treatment protocol. Then coming to the next protocol, what Charaka has explained. There are plenty of protocols, of course. I have highlighted some of the main one. Next one is a Shadopakrama. So we have seen that Langanam Brahmanam Kale Rukshanam Snehanam Tatha Svedanam Stambaram Cheva Janiteya Savai Bishak. The Bishak is the one who must know all these 6 line of treatments. So all it is Shat Sarvarogana Proktaha Samyak Upakramaha. That means all treatment procedures can be brought under these, and all these can be brought under the heading of the Dvividopakrama also. Dvividopakrama, what we have learned as Santarpana and Apatarpana. So they are broadly applicable in all the diseases, and it is a must treatment in all the diseases. We'll talk about that Dvividopakrama. What is the utility of Dvividopakrama? So Dvividopakrama, as we know, it is Santarpana and Apatarpana. So Apatarpana Janya Vyadhi must be treated. Next slide, please. Apatarpana Janya Vyadhi must be treated with the prescribed treatment of the disease along with the Santarpana. It is mentioned in Santarpani Adhyaya regarding the different diseases, and in those diseases, if it is Santarpana Janya Vikara, then Apatarpana has to be introduced for in that treatment, and the remaining treatment of the disease should be done. However, similarly in Apatarpana Janya Vyadhi, the treatment we must be doing, of course, along with that disease specific Santarpana has to be adopted, and then the treatment has to be continued. So Santarpana and Apatarpana, we need to differentiate between these two, whether this is coming under the Santarpana category or Apatarpana category. Then we must introduce the disease specific Santarpana, disease specific Apatarpana. We need to adopt it. So along with the prescribed treatment in Chikitsa Sthana, along with the treatment prescribed in other sthanas as well, we must adopt the Sutra Sthanokta Santarpana or Apatarpana. That is how the treatment has to be planned. Next, Apatarpana. There are 3 types of Apatarpana. Langana Pachana and Dosha Avsechana. As we know, Langana is for Alpa Dosha, Madhyama Dosha, it is Langana Pachana, and then it is for Bahudosha, it is a Dosha Avsechana we do. Next, how Charaka explains the Chikitsa. This is an illustration I am doing, how we need to recognize some of the points here. We need to recognize the Kriyapada while reading the Samhita. So it is Kriyakramamata Siddham Gulminam Gulmanachanam. I am taking an example of Gulma Chikitsitam where he is explaining about Ruksha Vyamajam Gulmam Vatikam Tivra Vedanam Baddha Vinmutra Marutam Snehir Adita Sampacharet Bhojana Abhyanjanaihi Panaihi Niruhai Sanvasanaihi Snigdasya Bijaja Svedaha Kartavyo Gulma Shantaye. Here, Samupacharet Kartavyaha, there are the two things. Kartavyaha means these are the Snigdasya Bijaja Sveda Kartavyaha. That means in Gulma, it is must for doing the Snehana and for the Snigdha person Svedana. So this is the Kartavya. That means we must do, this is the inevitable treatment protocol in Gulma Shanti. And Baddha Vinmutra Marutam Snehir Adita Samupacharet, Samupacharet. That means Upacharet is, of course, we must do it. Of course, Samupacharet means sufficiently and continuously, sufficiently, we must be doing the Sneha. Adita, in the beginning only, we must be doing the Snehana properly. The next sloka is saying Srotasa Mardam Krutva, Jitva Martam Ulbanam, Bitva Vivantam Snigdasya, Svedo Gulmum Apohati. So like that it is mentioned. We will see that in the next slide. But here, see the how he is explaining here. Snehapanam hitam gulme visheshena urdunabija. In urdunabija gulma, it is hita. This is just a advice. Then Pakwashagate bastihi. Like that he is explaining. In the second line, he is telling Snigdoshnani prayojayet. Prayojayet when he is using that nijanta. Sorry, when he is using that prayojayet word, it is indicating that we must be doing it. It is the ling lakara we are using. That lakara is indicating that with ling lakara when it is said, we must be doing Snigdha, Ushna, Brahmanani, Annapanani. This must be done. So like that, the insistence or the method of usage of the Kriya Pada is indicating what has to be done during the treatment protocols. How Svedana works in Gulma. Next slide, please. Here, Srotasa Mardavam Kratva, Jitva Martam Ulbanam, Bhitva Vibandam Snigdasya, Svedo Gulmam Apohati. So it is very nicely explained. Snigdasya. That means patient should be primarily Snigdha. For that Snigdha person, Srotasa Mardavam Kratva, then Martam Ulbanam Jitva, Vibaddam Bhitva, Svedo Gulmam Apohati. That means in Gulma, how Sveda does the karma, that is explained. How Sveda acts, it does the Srotasam Mrudutva, it brings in. Then Martam Ulbanam, it will be over. Then Vibandha, it will break open. Then Gulma Apohati, it will make the Apaharana of the Gulma, it takes out the Gulma. Like that, Svedana does all these steps. Step by step, it is doing that Kritva, Jitva, Bhitva when it is indicating that Twanta, that is the type of Kridanta actually. So each process is one after other, this is happening. That means initially Srota Samrudutva will be brought, then the Martha Ulbana, that Martha which has actually pulled the doja towards the Gulma, that will be controlled. Then already which is locked in doshas will be broken and it is brought out. So like that, the Svedana in the Snigdha person, Svedana does these many actions. So this is beautifully explained in Gulma Chikitsatam. So a good example I felt, so I am sharing this example here about the Gulma. An example of dosha-based treatment in the same chapter. Vatagulme kapho vruddho hatva agnim aruchimyati. Like that, he is telling where if the Vatagulma where kapho vruddhi is seen, then ullek hetutam, it is mentioned, ullekan has to be done. Then in Vatakapul Bane, if it is like Shula Anah Vibandha, if it is, then Vatakapahara, Gutika Churna has to be given. Then if it is Pitta, Pittamba Adi Samruddham Santapam Vatagulma. In Vatagulma, if Pitta Samruddhi happens, then Virechana has to be done. So like that, there are dosha-based treatment where the situation changes, it should be adopted. That is beautifully explained in Charaka Samhita. Likewise, the next one. Roga Eepetranodishta Bahutvan Nam Rupataha Tesham Api Etadeva Syad Doshadin Viksha Beshajam. Likewise, there are plenty of diseases which are unquoted, unmentioned because of innumerability. There can be a number of complex combinations of the doshas which may lead to so many diseases which are not all are explained. All those should be treated based on this method only. We need to adopt the Chikitsa Sutra as explained, we should identify the Kriya Padas used in the Chikitsa Sthana, and how the while explaining the Chikitsa, he will be using the Kriya Pada and Upasarga and like Kridantas and the Lakaras. So Lakaras, they are all indicating the Kriya, how it is to be done, when it is to be done. So Kala of that Kriya also is explained by the Lakaras. So that those things has to be followed, and that has to be adopted accordingly. And situational changes, modifications are also elaborated in Charaka Samhita. That also has to be noted, and that has to be followed accordingly. Importance of continuance of Patyahara even after the completion of the treatment. The Beshajak Shapite Patyam Ahare Reva Brahmanam. So when the patient is emaciated after the treatment, by the treatment itself, then how it has to be brought, how the patient has to be brought back to the Brahmana, or how we have to make the Brahmana, how to bring him back to his previous state. That is by the Patyahara only. So by the Patyahara, he will be like Vishama Hetu Tyaga he has to do, and Sevan of the Sama Hetu he has to do. The next slide, please. In that it is explained. In the next slide, it is explained that Vishama Hetu Tyaga, Tyagad Vishama Hetunam Samanam Chopasepanat, Vishama Nanubaddanti Jayante Dhatava Samaha. When Vishama Hetu Tyaga, when it is done, further association, precipitation of the dosha, further association with the dosha will not happen. So that much is ensured. Then Sevana of the Samahetu. Sama is the Hetubir Yasmad, Dhatun Sanjanayet Saman. By the Sama Sevana, that means proper Ahara Sevana, when we Patyahara, when we do, then it is going to generate the Sama Dhatus in future. It is going to nourish the Dhatus properly also. Hence, Vishama Hetu Tyaga and also Sama Hetu Sevana both has to be simultaneously done. It is not just about the consumption of the Patyahara. Vishama Hetu Tyaga also has to be done parallelly. Then next one is about Patya brings the Mrudutva and Alpatartha dosha. Katinyat Unabhavadva Dosho Antah Kupito Mahan Patyer Mrudvalpatam Nito Mrudu dosha Karo Bhavet. That means Patya Ahara brings down the Mrudutva and Alpatartha dosha also. It brings up the Mrudutva and the Alpatartha dosha, and shall bring the patient out of hatredness towards the Patya by different kalpana. We have to make the different ahara kalpanas so that he starts liking that Patyahara, and he leaves off the Vishama Hetu and he adopts the Sama Hetu. And by Patyahara, Vyadibala will also get Kshaya, and because the nourishment of the Samadhatu will start happening, so that resistance will start also generating. Hence, dosha will be resisted, dosha kopa will not be happening anymore, and dhatu will also move towards the samatva. Hence, it will be together, it will be happening. Next one. What modes a Vaidya must adopt for examining the patient? So before going for the Chikitsa, what has to be done? So why this I brought it here, not in the beginning, is it is the important one which is explained in the Vimanasthana. That is, Aptopadesha we have to use. That means what Aptavachana is there, that has to be understood first primarily. By the view of the Aptopadesha, we should go for the Pratyaksha. And with the view of Aptopadesha and Pratyaksha, we should move for the Anumana. And after that only we have to go for the diagnosis. And after all these procedures only, Chikitsa has to be adopted. So there is a methodical adaptation of that Chikitsa Siddhanta. It is not blindly Rogamado Parikshita Tattvanantaramashtam, what it is mentioned. In this pattern we have to go. It is not blindly when patient starts speaking about his symptoms and sufferings, we start calculating what medicine has to be given. That should not happen. So we should always be backed by the Aptopadesha. And through that only Chikitsa has to be adopted. Now coming to the very important point, that is how the treatment acts. The next one. So this is Beshajam to Dravyabhutam Sama Sharirotpade Samavaya Karanam Bhavatyeva Tena Dravyasya Arogyam Pati Sadhakatamatvam Sadhu. That means when we give the treatment, when medicine is given, it need not be medicine only, it can be ahara also. So when medicine is given, actually medicine is actually acting against the disease. So when we start consuming the aushadha, our deha will start becoming like that Samavayitva when it is attaining, that Bheshaja is attaining the Samavayitva with the Sharira. That means our body will start becoming as equal to that of the Bheshaja, and we will be able to counter the disease. This is how the mode of action it is. So these Rasaguna Virupaka, they are the tools of action actually. The mode of action is this one. Samavayitva it is attained by the Bheshaja about with the Deha, and the Bheshaja will be countering the Roga, like that. So the Dravya becomes the Sadhakatama for the attainment of the Arogya. It can be Roga or Arogya, whatever it is, the Dravya will be the reason, as we all know. Ahara Dravya will start ensuring the Dhatu Samyata. Aushadha will help to counter the Roga and the that Roga, so Dosha and also Roga. So Dhatu Samya, it is attained not only by the Aushadha, it is by the Ahara also. So the Dhatu Samya Lakshana, a new well-being index. We must adopt the Dhatu Samya Lakshanas as a well-being index. It is not just the new modern described Dhatu Samya Lakshana. It is about the modern explained well-being index. We must adopt the Dhatu Samya Lakshana because our ultimate aim is to attain the Dhatu Samya. So till attainment of the Dhatu Samya, the process is called as Chikitsa, not just till the absence of the symptom. The secret of success is Jnanabuddhi Pradipena Yona Vishati Tattvavet Aturasya Antaratmanam Nasarogam Chikitsati. This is in a Vetareka way it is explained. So by the help of the Shastra Gnana, when the patient, unless he puts himself into the patient's shoes and visualizes the Atura using the Shastra Gnana, he will be unable to treat. So he should have the Shastra Gnana and he should sit and analyze in the situation of the patient. Then only he can understand the situation or diagnose and understand the suffering of the patient. After that only he can plan the treatment. This is how the treatment has to be done. So in this presentation, I have tried to simplify the treatment process. The first important thing what I said was about the 4 step of the Charakukta Chikitsa, where Dosha Nivritti is the first one, Roga Nivritti is the second one, Nidana Parivarjana is the another one, and lastly it is a Dhatu Samya attainment. And another one, another important carry home point is about the application of the Dvidopakrama, where Santarpanotta Vyadhi should be treated with Apatarpana, then the treatment, and Apatarpana Janya Vyadhi should be treated along with the Santarpana, what is explained in the Santarpani Adhyaya. So giving importance for the Santarpani Adhyaya in all our treatment protocols will be inevitable in that way. So in that way we must treat it. So I conclude my presentation. I thank the organizers. I personally thank Dr. Rajapandi for giving me this opportunity. Hope this was useful, and expecting the further association with All India Ayurvedic Congress Tamilnadu chapter in future days also. Thank you very much.
Thank you, sir. Sir, there is a doubt in our session, sir. Sattvacha Chikitsa is for Manasika. Why Acharya mentioned Sattvam? What is the significance of mentioning Sattvam here as Sattvaja Chikitsa, not as Manasika Chikitsa?
Sattva is the primary core or the core component of the mind, in fact. Our mind is actually made of Sattva only. Rajas and Tamas are the doshas, as we know. Sattva, Rajas and Tamas, all the 3 are the gunas, of course, but only Rajas and Tamas are the doshas. Sattva is the basic component of a mind. So mind is basically pure, over which we have that Raga Adi by the Rajas and Tamas. Hence, Sattva is the one which is mentioned here. Sattvavajaya means actually Ahitebhyo, Arthebhyo, Manonigraha when we do. This Rajas and Tamas will be removed out of the Sattva and Sattva Prakashana will happen. For that purpose, it is mentioned as Sattvavajaya Chikitsa. It is not mentioned as Raja and Tama removal Chikitsa. It is not mentioned. Of course, it involves that Ahitebhyo, Arthebhyo, Manonigraha. If we do the Ahitebhyo, Arthebhyo, Manonigraha, that is sufficient for the Sattva Prakasha to happen. For that purpose, it is mentioned as a Sattvavajaya Chikitsa.
Thank you, sir.
Hope it is clear.
I think that clarifies all the doubt in our doubt sessions.
Yeah.
Sir, சரக்காவின் சிகிச்சை சித்தாந்தத்தை தெளிவாக புரிந்து கொள்ள வழிவகுத்த உங்கள் சிறப்பான பகிர்வுக்கு மிக்க நன்றி. Now, the enduring legacy of Charaka Samhita in the contemporary healthcare. பல நூற்றாண்டுகளை கடந்தும் சரக்க சம்ஹிதாவின் ஞானம் இன்றைய மருத்துவ உலகிலும் தனது ரிலிவன்ஸை தாக்க வைக்கிறது. அந்த நிலையான மரபை கான்டெம்பரரி ஹெல்த் கேருடன் இணைத்து பார்க்க வருகிறார் டாக்டர் ரேகா ஏஆர் அவர்கள், லெக்சரர், டிபார்ட்மெண்ட் ஆஃப் சம்ஹிதா அண்ட் சித்தாந்தா, கவர்மெண்ட் ஆயுர்வேதா மெடிக்கல் காலேஜ், நாகர்கோவில். இன்று த என்டியூரிங் லெகசி ஆஃப் சரக்க சம்ஹிதா இன் கான்டெம்பரரி ஹெல்த் கேர் என்ற தலைப்பில் நம்மோடு பகிர்ந்து கொள்ள இருக்கும் அவர்களை மகிழ்ச்சியுடன் வரவேற்கிறோம். Over to you, ma'am.
Am I audible?
Yes, ma'am. You are audible.
Yeah, okay. So, I'm very much privileged to present my topic, the enduring legacy of Charaka Samhita in contemporary healthcare. I'm very much delighted to do this presentation, especially on the occasion of Caraka Jayanti. So I'm thankful to the organizers of this All India Ayurvedic Congress, and I thank special thanks to Dr. Rajapandi sir for inviting me and giving me this opportunity. So not wasting, actually I wanted to thank, I was very much privileged to share the dais with Dr. Anandkatti sir. Sir was our teacher in Mysore Government College. Sir it was because of teachers like sir I am what I am today. So I owe a lot to Dr. Anandkatti sir and all other teachers of JMC, because they only had given me the knowledge and everything what I am today. So directly going to the slides. The enduring legacy of Charaka Samhita in contemporary healthcare. Just a minute. So the Charaka Samhita is a text which is known for its comprehensive approach to preventive, promotive and curative healthcare. It emphasizes on individualized treatment, ethical medical practice and holistic well-being, and which continues to resonate with the principles of modern healthcare even today. Despite the many remarkable advances in the modern medicine, still the world faces multiple challenges like lifestyle disorders and mental health issues, chronic disease burdens, antimicrobial resistance, etc. So, long before these concepts gained global recognition, Charaka Samhita advocated a healthcare system which was centered on preserving health, promoting health, and treating each individual according to their personalized constitution and etc. So, these principles of Prakriti-based personalized medicine and the preventive health aspects like Dinacharya, Ritucharya, Sadvrita, rational therapeutics and compassionate medical ethics, everything continue to inspire the modern healthcare even today in the form of preventive medicine, lifestyle medicine, etc. So as we celebrate Charaka Jayanti, this presentation explores how the timeless wisdom of Charaka Samhita remains even relevant now in addressing the major contemporary healthcare challenges and contributes to the evolving paradigm of patient-centered and evidence-based care. So these are some of the areas in which Charaka Samhita has a major influence. So first is the preventive medicine, medical ethics, personalized medicine, nutrition and lifestyle, then public health, mental health, research and evidence-based approaches, and holistic health care, etc. So coming to the preventive health aspect. So this is one of the reference from Charaka Sharira, which completely, it condenses the entire thing into the into a gist. So, because whatever preventive measures mentioned in the form of Ritucharya, Dinacharya, Sadvrita, etc., is completely summed up into this shloka. So this is like a Naro Hitahara Vihara Sevi Samikshakari Visheshu Asaktaha Data Samaha Satyaparaha Kshavan Aptopasevi Cha Bhavati Arugaha. So Matir Vachaha Karmaha Sukhanubandam Videya Sattvam Vishuddha Buddhihi. So all these things. So whoever is following all these things, na anupatanti rogaha. So whatever is mentioned in the form of Ritucharya, Dinacharya, Matravat Ahara, then Navegandharaniya, and a part of Sadvritta like Aptopasevi, Data, Samaha, and a part of Achara Rasayana. So it is a condensed form of whatever measures is mentioned in the form of preventive health. So I've taken this difference. So next, coming to the personalized medicine. So first of all, what is personalized medicine? An approach to healthcare in which prevention, diagnosis, and treatment, everything is tailored to an individual, which is unique, individual's unique clinical, physiological, and lifestyle characteristics. So then coming to the precision medicine, it is a little more advanced medicine and is an emerging approach which considers individual variety in genes, in their environment and lifestyle to improve disease prevention and treatment. So in this, patients are grouped in the form of strata based on some common characteristics, and they are grouped to predict the most effective interventions. So coming to the personalized medicine, as per Charaka Samhita, it is strongly reflected through Prakriti, Dashavidha Pariksha, Atura Pariksha, then Agni Pariksha, Bala, Satmya, Sattva, Ahara Shakti, Vyayama Shakti, etc. Coming to the precision medicine, Charaka Samhita does not describe genomics or molecular biomarkers, but however it emphasizes on patient stratification based on some common characteristics like based on age, based on Prakriti, based on the desha where they live. So the individual, they are grouped in the form of stratas to attain effective therapeutic management. So he adopted a multidimensional approach to patient stratification, like I already told you, into like based on Atura Pariksha, like Dashavidha Atura Pariksha, Agni Bala, Desha, etc. So all that this differs from the genomic-based stratification used in modern precision medicine. It almost reflects the same underlying principle of tailoring treatment according to the patient's specific needs and also the characteristics. So there is something called as chronotherapy, which can be considered as a part of personalized medicine. So chronotherapy is the administration of medications according to the body's biological rhythms to maximize efficacy and minimize the adverse effects. Like I would like to give some examples. Antihypertensives are more effective when taken at bedtime. Then statins usually given in the night because cholesterol synthesis. Corticosteroids are given in the morning because it mimics the cortisol secretion, like this. So, but here according to Charaka, the timing is, of course the chronotherapy is there, but the Aushadha Sevana Kala is more oriented towards the dosha, disease pathogenesis, Agni, and the site of diseases, like that. So the concept of Aushadha Sevana Kala described in the Charaka Samhita highlights that the therapeutic effect of medicine depends not only on the drug, but also on the time of administration. Although modern chronotherapy is based on circadian biology and molecular mechanism, both approaches recognize that optimal effect of a drug therapeutic outcome is influenced by the biological timing. So this modern chronotherapy recognizes the effect based on gastric emptying, hepatic metabolism, hormone secretion, blood pressure, drug metabolism, which all vary according in the course of the day. See, the same thing is like thing is explained in Ayurveda as in the form of like Vayoho Ratri Bhuktanam Te Anta Madhya Adigaha Kramat. So this refers the circadian rhythm and the time of aggravation of doshas, or the maximum predominance of doshas based on the day-night cycle and based on the time of digestion. So this thing plays a major role in deciding the time of administration of the Aushadha, and this also helps in analyzing the outcome, effective therapeutic outcome. Like for example, pranavayu agni praveshakrit is the kriya. So grasa aushadha kala is selected for that. And samanavayu agni samipastaha, and it is situated in it is annam grahanati pachati vivecheti munchati. So madhya ishyate, for samana dushti madhya aushadha kala is selected. So this is nothing but it is even relevant in the form of modern chronotherapy, though the objective, not the objectives, though the modern chronotherapy recognizes the effects based on its own principles, like for example immune function, blood pressure, etc. So coming to the precision medicine, so though we don't follow the genomics principles, molecular biomarkers, etc., but we have our own, Charaka Samhita has its own way of understanding the precision medicine. So this is one of the reference. Natu kevalam guna prabhavad eva dravyani karmukani bhavanti. So the action of a dravya is not only decided based on the guna alone. Okay. So dravya prabhavat, guna dravya prabhavat, द्रव्य गुण प्रभावात् तस्मिन् काले तत्तदधिकरणम् आसाद्य तां च युक्तिमर्थं च तम् अभिप्रेत्य यत् कुर्वन्ति तत् कर्मः, येन कुर्वन्ति तत्र वीर्यं, तद्वीर्यं, यत्र कुर्वन्ति तद् अधिकरणं, कुर्वन्ति स कालः, यथा कुर्वन्ति स उपायः, यत् साधयन्ति तत् फलम्. So if you see Acharya Charaka's concept based on the what the shloka what we read now. So the dravya, as per the modern pharmacology, is the active pharmaceutical ingredient, and the guna of a dravya is the physico-chemical properties, example this molecular characteristics, etc. Then ena kurvanti, by means of which the action is exhibited. So the pharmacodynamic potency and therapeutic activity. And karma, pharmacological action. Okay. Then yatra kurvanti sadhikaranaha, so that is the target organ or the tissue receptor. Then yada, like how long it takes. So the means the timing of drug administration and what time it will be effective. So chronopharmacology. And upaya, so yatha kurvanti, so the methods of administration of the drug and the formulation and how the drugs are formulated and what basis. Like for example, if you see in rasayana dravyas, especially wherever amalaki is told as a rasayana, loha will be a part of that formulation, because even now the principle is relevant, because whenever the iron absorption, it has to be supplemented with vitamin C. So if you see the Trifala Rasayana, Lohadi Rasayana, everywhere you will find Loha and Amalaki as a part of combinations. And coming to the Artha, which that is a therapeutic indication. And the Phala is a clinical outcome and efficacy. So, as we all know, Yoga Mahasamta Yaha Vidya Deshakalopapadhitam Purusham Vikshya Sagniyo Bhishagutamaha. So this verse aligns conceptually with the precision medicine, where the treatment is individualized according to the patient characteristics, disease characteristics, kala, the Vyadhi Avastha Kala, and then the appropriate drug selection, and the timing and the expected therapeutic response. So, although Acharya Charaka does not describe molecular or genomic mechanism, he recognizes the framework of drug efficacy. It depends on treatment-specific variables as well as patient-specific variables, rather than the drug alone. So there are multiple factors which influence the drug pharmacology. So coming to the medical ethics part, so this is the prime ethics which we have to follow as a physician. So na atmartham na api kamartham ataha bhutadayam prati vartate chikitsayam sa sarva bhuta hita hiteritaha. So it does not formulate the exact bioethical principle of equal treatment, but it emphasizes the medical ethics in a different way. Like, it is not whatever treatment we are doing, it is not with the selfish motive, like earning artha or our own well-being. It is not like that. It is only for the bhutadaya, that is compassion towards all the living beings. So which somewhat aligns with the contemporary principles of justice in healthcare. So if you see the qualities of Vaidya, we find various different references based on the context. Suppose in the second chapter of Sutrasthana, wherein Apamarga Tanduli Adhyaya, wherein all the Panchakarma procedures will be explained. So there, the explanation of a Vaidya, he is telling Smritiman, Hetu Tigno, Jitatma, Pratipattiman. Vishakaushada samyogahi chikitsam kartum arhati. So, wherein Panchakarma, it is a major treatment procedure what we follow in Ayurveda. In that case, Pratipattiman is mentioned. So, Pratipatti Jnana, what is Pratipatti Jnana? Yatha vikara, Yau vikara, Yatha Pratipattavyaha, Tatra Anushtana Jnanam. So, what is the vikara and how we have to, that exact presence of mind, and what treatment plan we have to do exactly, because Panchakarma, we may find lot of complications happening. So in that case, they have explained Pratipattiman as one of the quality of Vaidya. Whereas in Kudaka Chatushpada, Shrute Paryavadatatvam, Bahushadrashta Karmata, Daksham Shaucham, all these qualities is explained as the Vaidya Guna Chatushtaya. Whereas when it comes to the context of Pranabhisara Vaidya, Pranabhisara means Prana Vyavartate, one who is about to die. For such a person, life-saving physician is one of the is required. Such a physician, in while explaining that Shastra Artha Vijnana, so it is not only Shastra Vijnana, Artha Vijnana, because during emergency situations, the physician should have the potential ability to decode what is deeply explained in the Shastra Arthas. So that is explained in the context of explaining the Pranabhisara Vaidya. Whereas explaining the Vaidya Vritti ethics, he explains Maitri, Karunyam, Marteshu, Shakya Pritihi Upekshanam, Prakristeshu Bhuteshu, Vaidya Vrittish Chaturvidam. So Maitri, compassion, friendliness, compassion, all these things. And wherever possible to treat, when the Vyadhi is sadhya, you do it. And when it is not, when it is beyond the limit, like when the patient is approaching the Prakriti, that is nearing the death. So please avoid them. So this is all the ethical principles what they have mentioned in the for the Vaidya, which these are all gunas. Like one more thing, Vidya, Vitarka, Vijnana, Smritihi, Tatparata, Kriya. So all these things are explained to signify the ability of the physician. The physician is a normal person, so he should be equipped with all the knowledge, Shastra, Artha, Vijnana, and he should have the ability to Vitarka, logical reasoning, or he should have the ability to inquisitively analyze the Karyakarana Siddhantas, what is happening, why it has happened, and it has happened, what has to be done, Pratipatti Jnana. So all these has been explained as Vaidya Gunas in medical ethics. So this is another one reference for medical ethics to be followed. So he has, like, usually in the contemporary healthcare also, there is always a warning for the physicians to treat beyond one's competence. So just the same way, Charaka Samhita also emphasizes ethical selection of patients when the disease is incurable, when the prognosis is hopeless, and supposedly if the physician lacks the necessary resources, like when there is chatushpadas are not available or something like that. Or sometimes treatment may bring illness, means disrepute for the physician. In all these conditions, a responsible allocation of effort was advised rather than completely abandoning compassion. So, if you see this example in the concept of Gulma Adhikara, when Shastra Chikitsa is advised for Kafaja Gulma, he is telling once the Pakwa Gulma is been surgically excised and other things have been done, Tataha Dhanwantariyanam Adhikaraha Kriyavido Vaidyanam Krita Yogyanam Vyadha Shodhana Ropane. So he is telling, till here I am managing. So after this, once it becomes like a vrana, it is better you refer for the well-versed physicians like Dhanwantri Adhikara. So he is telling you better take the help of Sushruta Samhita. So this is one of the very good reference, like how ethically they have practiced, like they have followed ethical principles, like whenever there is necessary for referral, you have to do. So a physician should not treat beyond one's own competence. So that is why before entering into Chikitsa Sthana, Indriya Sthana is placed to analyze the prognosis, analyze the limitations of a physician. So where to start the treatment, where I should avoid the treatment, all this is explained. And this is another one reference which is explained in the context of Sannipata Udara. There is Vishaprayoga is explained. So this is almost similar to the risk consent what we do in the contemporary healthcare. See, Nyatan Sukhru Brahman Rupatin Gurun Anugnapya Bishak Karma Vidatyat Samshayam Bruvan. So he has to call the loved ones of the patient who is suffering, because they are going to do a critical thing on the patient. They are going to do a Visha Prayoga, which is very dangerous. But they are, how he is explaining, you see, Akriyayam dhruvo mrutyuhu, kriyayam samshayo bhavet. So he is explaining the samshaya bruvan. You call the people, means the loved ones, and you educate them like this is the situation, and we are going to handle the case. So how they are explaining, Akriyayam dhruvam mrutyuhu, kriyayam samshayo bhavet. So anyhow, Sannipata Udara is somewhat a critical condition. So even if we do this, I mean Akriyayam, if we are not doing this prayoga, definitely mrityu can happen. Even if you do the kriya also, there is samshaya only, not a 100% possibility of life for the patient. There are chances, but you have to, if you want, you can take the chance. So that is a form of risk consent explained in the context of Udara, Visha Prayoga. So this is another one thing explained. So yogaha shamayed vyadim yaha anyam udirayet na so vishuddhaha shuddhastu shamayed yaha na kopayet. So treatment is that which should not cause one more disease. See, if you are targeting a particular disease, they should have, restoration of health should happen. Instead, some other diseases emerging. So such a chikitsa is can never be considered as a Shuddha chikitsa. Shuddhastu shamayet yahana kopayet. So this earliest expressions of patient safety, the modern ethical principle, contemporary healthcare principles, ethical principles do no harm. So better treat the patient. If you should treat in such a way that yahan anyam na udirayet. You should not cause any new another diseases. And this is also rational therapeutics, etc. So again, we have seen this. So till here completes the ethics. So from Charaka Samhita, what all ethical principles they have guided us, which is even relevant to the contemporary healthcare. So now coming to the mental health part. So this is one reference from Sharirasthana, which says that Shariram hi api sattvam anuvidiyate, sattvam cha shariram. So this is one of the beautiful reference which forms the basis of all the psychosomatic illnesses, as the interrelationship between the sattva and sharira is explained. It was derived long back in the text. So again, this is again one unique chikitsa explained in the context of Unmada chikitsa. So Paraspara Pratidvandva chikitsa, which is again it forms some major foundation for most of the psychotherapies and most of the stress management techniques, etc. So what is Paraspara Pratidvandva chikitsa? So if there is an emotional disturbance, you replace it with the opposite emotion from which the patient is suffering. So like for example, suppose a person is in krodha, you can replacing anger, that emotion, with the kshama. Suppose you are angry on someone, you can make them practice with forgiveness. So this can be related with the emotion regulation of the modern psychological concept. Suppose if a person is in fear, dhairya, instilling the courage. So again, anxiety management techniques. If a person is in grief, you have to give ashvasana, reassurances, which is nothing but supportive psychotherapies. If a person is ignorant, so which is nitya, all this means the jnana is not there. You have to you have to replace with jnana. Okay, ajnana, jnana. So psychoeducation. See, what you're doing is wrong. People are suffering like that. So you have to give the education properly. Suppose lobha is there, you have to replace it with affection. So irsha, compassion focused therapies can be given. Suppose lobha is there, you can practice with contentment. So basically restructuring of the cognitive restructuring techniques, and maladaptive thoughts. For that, cognitive behavior therapy, etc. So this is again a good reference from Unmada Chikitsa. Na eva deva na gandharva na pishacha na rakshasaha na cha anye swayam klishtam upaklishnanti manavam. So while in the context of Unmada, he explains certain grahaveshas like Devadi grahavesha, Pishacha, Rakshasa, Pitru grahavesha, etc., etc. And he is explaining some lakshanas also for that grahavesha. And finally, summing up Agantuja Unmada, in the context of Agantuja Unmada, finally while summing up, he says, Swayam klishtam upaklishnanti manam. See, whatever explained as external spirits like Deva, Gandharva, etc., they are not the sole reasons for the disease what you are suffering. So it is only you and your thoughts and your karmas is that which is making you suffer like this now. So another following shloka, it will explain that Atmaneva manyate kartaram sukha dukkha yogo. So sorry. Atma, that's we are the individual is the reason for the afflictions of the Devadi Grahas, etc. But as such suffering is not happening to the person. So in contemporary healthcare, also we can find it relevant because not all individuals, see, when a stressful situation is there, not all individuals are affected by the extreme stress. Some could tolerate the pressure, some will have good resilience, and they will come back more potential than what has happened to them. So, but some, because of the susceptibility, because of the avara sattva, they become more prone for such diseases. So here he explains the susceptibility of the illness which can happen to the persons. So they are the main agents, and the others are the external sources. Okay. So that is why even in the Unmada Samprapti, the Samprapti starts like Taihi Alpasatvasya Pradushtaha Malaha Hridayam Pradushi Buddhehe Nivasam. So means not all the individuals are affected with such diseases. Only the Alpasattva persons are more prone or susceptible for such diseases. So this is again a beautiful reference, or a very good reference, which explains about, I think most of you will be knowing this Achara Rasayana. So Achara Rasayana is explained in the last part of Rasayana. So the reason is, first they would have explained about Shilajita, Pippali, Vardhamana Pippali, Triphala Rasayana, Brahma Rasayana, etc., etc. So not all are able to afford such little bit of costlier treatment. So this type of Achara Rasayana can be made affordable to all of them, irrespective of their socio-economic status. One reason is that could be. Another thing is, there is something called ego defenses explained in the contemporary healthcare. So like the ego defenses are unconscious conflicts of the ego. Like how physical body has a defense. Like whenever a disease happens, our physical body immune system starts defending against the disease. So there is a defense system for the physical body. Same way for the mental suffering or the conflicts, emotional conflicts, there is something called ego defense mechanisms, which is unconsciously operating in all the individuals. But these become maladaptive behaviors when they are persistently getting involved into it. Like I can give you some examples for it, like projection. This is one ego defense, wherein you will be angry on the boss and you will not be able to do anything for him, and you will choose an easy target to show your anger. This is a defense, ego defense, projection. And another one is acting out. This is very common in teenagers or who are not able to have a control over their senses. Especially you can see people banging their heads on the walls, or shouting in the public places, or shouting at the other person because they have angered the person, like that. So this is again a immature ego defense, acting out ego defense. And some other ego defense is there, denial. So denial means if suppose a person has lost a loved one, immediately he will not accept that the person is no more. So he will still believe that there is some hope. No, he will return back. No, he has not left me, like that. So that such a defense is a immature ego denial. Some people will live in that. But there is one other ego defense, which is a mature form of ego defense, and this modern society uses as a major tool in structuring the mature ego defense in individuals. Whoever is having immature ego defenses, and who because of that they will have so many emotional conflicts, like denial of emotion, denial of grief. They will be going into deep depression. And acting out, they will become more aggressive if this practice is continuously practiced. I mean, this ego defense is continuously practiced, it will become like a maladaptive behavior in the due course. And but to overcome all such emotional conflicts, Sigmund Freud, he constructed a very good mature ego defense, which is nothing but altruism. And in the altruism, nothing is explained. They are just telling the persons to be compassionate, to keep serving others, so that they will get some satisfaction out of it, so that they will overcome the conflicts whatever they are going through. If you see most of the spiritual classes and most of the spirituality teachers, what they advise is you do seva. Seva is nothing but volunteering yourself, and you have to try volunteering and losing the ego, so that all other emotional conflicts will not be a matter for them. So if you see this Achara Rasayana is nothing but, apart from some good practices, see if you see Satyavadinam, Akrodam, and Ahimsakam, then Priyavadinam, so compassionate, Dana Nityam, Tapasvinam, and all these things, like then Yuktignyam, Shastacharam. So all these are the Dharma Shastra Param Vidyatnaram Nityarasa. So whenever such an emotional conflict is there, when you are engaging yourself in volunteering yourself to the upliftment of others, naturally the emotional conflicts will turn into a good emotion. So coming to the nutrition and lifestyle, this is a reference which states that Anna is everything. Pranaha, Anna is Pranaha. Pranaha Pranabhutam Annam Loko Abhidhavati. Varanaha Prasadaha Sausvaryam Jivitam Pratibhasukam. So it gives Tushti, Pushti, Balam, Medha, Sarvam Annam Pratishthritam. So this itself says that Anna is everything. It not only gives nourishment to the body, mentally also it gives the happiness, tushti, medha, cognitive functions it improves, and complexion, everything is dependent on the anna what you take. So while explaining this nutrition, they have given importance to both quantitative and qualitative ahara. So there is no anything like calories. The ahara is not explained in the form of calories, because they have described matra they have defined matra which can never be accommodated in the form of calories. See, if you see yavadasya ashanam ashitam anupahatyam prakritim yatha kalam jaram gacchati tavadasya matra pramanam veditavyam bhavati. So yavadasya Anupahatya Prakriti means that is considered as matra which does not affect the Prakriti. Prakriti means normalcy of the doshas, and Yatha Kalam Jaram Gachati, that is the matra for that particular individual. So based on this pramana, calories can never fit into the definition of matra, like this much age, this much calories, this weight, this much calories. No, not at all. But there are some other nutritional principles which were explained in Charaka Samhita can fit into the contemporary healthcare. Like there are the Ashravida Ahara Vidhi Vishesha Ayatanas, which is nothing but the evidence for personalized nutrition, which is one of the major topics, emerging topic in the healthcare now. And coming to the nutritional epidemiology, again, this is one of the nowadays. Previously, some decades ago, there was no relevance of food on the disease. But now, even those modern physicians, they recognize the interaction or the effect of food on the body. And that is how nutritional epidemiology came into existence. So this nutritional epidemiology is the study of the role of nutrition in understanding the etiology of disease. So this is what we are doing. An entire Charaka Samhita for every disease, Ahara, Hetus, Nidana Sevana is explained. And the monitoring of nutritional status of populations. See, like, and the development and evaluation of interventions to achieve and maintain health. So this Prakriti, this type of Ahara is good. And like that, the groups, like based on the needs, based on the metabolic demands, how much of food and what type of food is good. Now, what are Nitya Abhyasa Dravya? There is no classification of foods based on the nutritional values. They have classified certain dravyas as Nitya Abhyasa Dravyas based on the doshas, interaction with the doshas. And some dravyas cannot be based cannot be served in Nitya basis. So that is also based on the doshas. So basically the objectives of nutritional epidemiology is to identify the dietary factors and in relation to the disease risk, and to assess the nutritional status of the populations. So to understand the relationship between diet and chronic diseases, and not only identification, based on the identification, developing some evidence-based guidelines, dietary guidelines. See, prameha, we have derived the hetus. These are the Kafakritcha Sarva Hetus is described as Prameha Vriddhi Hetus. So what we are doing? Nidana Parivarjana. So to formulate evidence-based dietary guidelines. So they have given a set of aharas. These can be given as Patya aharas. Yava is good. Then Venu Yava is good. Atisi Taila can be given. Like that, they are framing based on the relationship between the diet and the chronic diseases. Finally, to evaluate the effectiveness of nutrition interventions, whatever nutrition interventions, suppose when we are doing upakramas, rukshana upakrama, we are putting the patient on the diet, okay, patarpanajanya diet. So how we are assessing the evaluation based on the samyak langita lakshanas. So all this is fulfilled from our Charaka Samhita. So this is the modern nutritional epidemiology. The diet influencing disease risk, which is nothing but the patya apatya described in every diseases. And there are some food patterns affecting long-term health, which is described in the form of Viruddhahara and Gramya Aharas. And individualized nutrition is nothing but is explained in the form of Ashtahara Vidhi Vishesha Hayatanas. And nutrition for a population is explained in the form of Ahara Vidhis, like Shadrasaha, Madhura Prayaha, then all these things, like they have been explained as rules. Then prevention through healthy diet. Lot of things are explained. Matravata Ahara, then Nitya Abhyasa Dravyas, etc. etc. So this is another reference in the context of Pranakamiya Rasayana Pada. So it says that Sarve Sharira Dosha Bhavanti Gramya Ahara. So they have grouped up like this is an example for nutritional epidemiology. They are categorizing certain group of aharas, and of course some viharas are also mentioned, and some patterns of eating like Vishamashana, Adhyayana, etc. And they have categorized the aharas into like these type of aharas: amla, ati lavana, ati amla, ati katurasa ahara, shariya padarthas. So all these foods and some group of foods like viruda dhanyas, then shami dhanyas, all these things. What effect it has? What effect it has on the sharira? See, this is what the nutritional epidemiology says. To understand the relationship between diet and chronic diseases. So after understanding this, formulating the evidence-based dietary guidelines. So if you see this, what these Gramyaharas and Viharas are doing, Shitili Bhavanti Mamsani, Vimuchyante Sandayaha, Vidahyate Raktam, Vishyandete Chanalpam Nedaha, Na Sandiyate Astishu Majja. So Shukram Na Pravartate. So Shitili Bhavanti Mamsani, Vimuchyante Sandayaha. That means Vidahyate Raktam. So viscosity in the blood can increase. All these are like interpretations, so which may lead to blood pressure, which may lead to thrombus formations, etc. etc. Vishyandete chanalpam medaha means there is liquefaction of the medas. That means free fats or insulin resistance, which may lead to metabolic diseases like development of diabetes mellitus, etc. Nasandiyate astishu majja, like immune intolerances, which can lead to some autoimmune diseases, cancers, etc. So all these things, like there is definitely nutrition and disease relationship was derived in the science. So these are some of the contemporary healthcare challenges like lifestyle disorders, which can be managed through dinacharya, ritucharya, patyaharas, exercises, etc. So the rising burden of chronic diseases, as we saw just now, Nidana Parivarjana, Rasayana, individualized treatment can be done based on the Charaka Samhita's approach. Like as we saw now, mental health disorders, nothing but the Satvavaje Chikitsa, Ahitebhyo or Tebhyo Manonigraha can be done, Sadvrita can be followed, Achara Rasayana can be advised for them. And this is one personalized medicine what we finish now. There is no anything like one size fits all treatment. So tailored medicine is one of the emerging trend in the contemporary healthcare that has been already part of our Samhita without Yes. And one more major threat described by WHO is the antimicrobial resistance explained. So their rational use of medicines, then appropriate drug selection, all these can help overcome this antimicrobial resistance. So if you see Jwara Chikitsa of Charaka Samhita, in the Navajvara Avastha, while explaining the Chikitsa, Langhanam, Svedanam, Kalo, Yavagu, Tiktako Rasaha, Pachanani, Avipakwanam, Doshanam, Tarunejvare. So the first line of treatment is a non-therapeutic dietary guideline, which means not even dietary guideline, just do Langhana. Fasting itself is a major treatment protocol. That means this is all with the vision of antimicrobial resistance. Could be not antimicrobial resistance exactly, drug resistance. So that is why they are starting the therapy without any therapeutic intervention, just Langana, which can normalize the Agni. If not, go for Svedana, like Paniya, Jalas. If not, if the Kala, like if the appropriate time has reached, can go for Sadhyo Vamana. Then Yavagu preparations, then only Tiktaras, then only comes the medicine. So all these are explained with the vision of the drug resistance which may develop in the patients. That could be the reason. And for the increasing healthcare cost, only thing is prevention, as I already told you. Narohitahara Vihara Sevi, Samikshakari, Data, Samaha, Satya Paraha, etc. If all this is followed, Swastha Rakshana can happen. Then for the aging population, again, Rasayana therapy, promotion of longevity, all these things can happen. So ethical challenges, all these things we just now completed. So research and evidence-based approaches. One of the references in the context of Sadhya Sadhya Vyadi, Acharya says, like in the context of like Maitreya, he will ask, like, there is no difference between Bheshaja and Abheshaja. So while explaining the Sadhya Asadhya and while explaining the answer for Maitreya, he says this verse, Parikshakarino hi kushala bhavanti. So one who is always involved in examining, he can be apt physician, or he can be a proficient physician in treating the diseases. So first of all, he should do the pariksha whether a person is sadhya or asadhya. In such a context, he says which explains the vision of them, like how much research oriented or how much research oriented treatments they were thinking of. And this is again Siddhanta definition itself says they were more everything, whatever they did, whatever Siddhantas were framed, like Karyakarna Siddhanta, Samanya Vishesha Siddhanta, Lokpurusha Samya Siddhanta, everything was not just named as a Siddhanta. All were subjected to Parikshakaihi Bahuvidam. So too much of research activities were done on that Pariksha Hetu Bishcha, and they were not just like they were not like placed as Siddhantas. They were given logical reasoning behind that, why this is like this, why this can happen like this, which is relevant even today also. So just now only the contemporary health is looking into the cause and effect as one of the major thing in the treatment. So Sasadhet was Tapete Nirnaya. And they were very clever in identifying hypothesis as a part of research. So that is why Abhyupagama Siddhanta is placed in the last part. Yamartham Siddham Aparikshitam. So this is placed in the last. Vadakale Abhyupagachanti Vishajaha. So just like during a conversation or during a scientific debate, such an idea, that hypothesis emerges. So that is placed in the last part. So that's what I think previous speaker Dr. Nagesh sir also was speaking about the same thing. First from the Aptapadesha, the published literature which is relevant in the modern research as published literature, background evidence. We move on to the Pratyaksha, that is clinical observation and data collection, and from there we do the Anumana, which is nothing but can be related to statistical inferences and interpretations. And coming to the Yukti, clinical reasoning, etc. So again, The Pariksha Bhavas explained in Charaka Samhita also emphasizes the systematic examination of patient. So all these, though not very much relevant to the modern research methodology, the fundamental research principles and the interventions should be based on careful assessment of relevant variables, all these supporting the individualized and evidence-based clinical decision making. So conclusion. So Charaka Samhita remains a timeless foundation of Ayurvedic medicine. It is distinguished by its emphasis on prevention, individualized care, ethical medical practices, etc. So we saw that its principles starting from public health and nutrition to mental well-being, patient-centered care, it continued to offer valuable insights that align with the contemporary healthcare principles. So Charaka Samhita envisioned medicine as a science which is guided by Pratyaksha Pramana and further moving into the logical reasoning through Anumana and the rational application of the same by Yukti Pramana. And we find his teachings on Janapadodvamsa, which highlights the importance of environmental determinants of health, and his detailed dietary principles behind every Chikitsa chapters, the Patya and the Ahara Vidhi. This all continue to inspire discussions on nutrition and preventive health care. So while modern medicine is grounded in the current scientific methods and evidence, it provides an enduring philosophical and clinical framework that continues to inspire integrative research, innovation, and compassionate healthcare. So its greatest legacy not only in its historical significance, but in its continuing relevance to addressing patient present and future health challenges. This enduring vision makes the Charaka Samhita not only as a classical text, but it is a living guide for the contemporary healthcare. So on this day of on this celebration of Charaka Jayanti, let us all take an oath to live by this principle. Tadeva yuktam bhaishajyam yad arogyaya kalpate sacheva bhishajam shreshtam rogebhyo yaha pramoche. So he is considered as a uttama physician who is able to restore the health of the patient, and that is considered as the uttama bhaishajya, which is helpful in restoration of health. So let us strive hard to become such good physicians in the future. I thank the All India Ayurvedic Congress for giving me this opportunity. Thank you all for your patient listening.
Thank you, ma'am. Madam, Charaka Samhitaவின் நிலையான மரபு இன்றைய ஹெல்த் கேருக்கும் எவ்வளவு பொருத்தமானது என்பதை அழகாக எடுத்துரைத்த உங்கள் சிறப்பான உரைக்கு மிக்க நன்றி. Thank you, ma'am. That was a lot informative too.
Thank you.
Now, இந்த நிகழ்வின் ஒவ்வொரு பகுதியையும் நினைவாக மாற்றிய அனைவருக்கும் நன்றி கூற AIAC Kanyakumari Zone in Secretary Dr. Karthikeyan அவர்களை vote of thanks வழங்க அன்புடன் அழைக்கிறோம். Over to you, sir.
Thank you. Om Namo Dhanwantri. All India Ayurvedic Congress Tamilnadu Kanyakumari Zone ஓட இன்னைக்கு நடைபெற்ற Charaka Jayanti 2026 ஓட நிறைவு பகுதிக்கு வந்திருக்கிறோம். இந்த நன்றியுரையை வழங்குவதற்கு எனக்கு கிடைச்ச பெரும் பாக்கியமா நான் நினைக்கிறேன். ஃபர்ஸ்ட் ஆஃப் ஆல், இந்த நிகழ்வுக்கு கலந்து சிறப்பித்த டாக்டர் இளஞ்செழியன், ஆல் இந்தியா ஆயுர்வேதிக் காங்கிரஸோட பிரசிடென்ட், பிரின்சிபல், இம்மானுவேல் ஆயுர்வேத காலேஜ் நாகர்கோவில், டாக்டர் தன்வந்திரி S.Premvel, former All India Ayurvedic Congress President, Dhanwantri, Vaidyasala, Madurai. Thanks for coming today and always supporting us. Thank you very much, sir. My respectful thanks to our beloved All India Ayurvedic Congress, Adhyayana Gurus, Dr. S.N. Suresh, Sri Venkataramana Vaidyasala, Karur, Dr. S.Hariharan, Viswanath Ayurvedic Hospital, Senkottai, தங்களின் வருகையும் ஆசியும் இன்றைய நிகழ்வுக்கு பெரும் சிறப்பை சேர்த்துள்ளது. தேங்க்யூ வெரி மச் சார். A special thanks to our great guest speaker, Dr. Anandkatti, Department of Sangeeta Siddhanta, Government Ayurveda College, Bengaluru, Dr. SriNagesh K, Department of PG Studies in Ayurveda, Siddhanta, Sri College of Ayurveda, Bangalore, Dr. Caraka Jayanthi, Department of Sangeeta and Siddhanta, Government Ayurveda College, Madurai. உங்களோட சிறப்பான உரைகள், ஆச்சாரிய சரகரின் தத்துவங்களை நாங்கள் இன்னும் ஆழமாக புரிந்து கொள்வதற்கு ரொம்ப ஹெல்ப்ஃபுல்லா இருந்தது என்பதை நான் இந்த நிகழ்வில் சொல்லிக்கிறேன். இந்த நிகழ்ச்சியில கலந்து கொண்ட நம்ம ஆயுர்வேத டீச்சர்ஸ், மருத்துவர்கள், ஆராய்ச்சியாளர்கள், ஆல் இந்தியா ஆயுர்வேத காங்கிரஸோட கன்னியாகுமரி சோன், தமிழ்நாடு சோன் உள்ள அனைவருக்கும் என்னோட நன்றியை தெரிவித்துக் கொள்கிறேன். Finally, a big thanks to everyone watching and supporting us live on YouTube from different places. Your support makes this event a great success. நீங்க இல்லைன்னா கண்டிப்பா இந்த ப்ரோக்ராம் வந்து பெரிய சக்சஸா இருக்காது அப்படிங்கிறதா என்னோட எண்ணம். கண்டிப்பா இந்த நிகழ்ச்சிக்கு முக்கிய காரணம் ஒவ்வொரு யூடியூப்ல இருந்து பார்க்கக்கூடிய ஒவ்வொரு வியூவர்ஸும் நான் ரொம்ப தேங்க்ஸ் சொல்லிக்கிறேன். தேங்க்யூ ஆல் ஒன்ஸ் அகேன். லெட் அஸ் கண்டினியூ டு சர்வ் பீப்புள் த்ரூ ஆயுர்வேதா. தேங்க்யூ.
Thank you, sir. With this, we bring the Caraka Jayanti commemoration 2026 to a close. May the timeless wisdom of Acharya Charaka continue to inspire us in our learning, practice, and service to society. Thank you all our respected dignitaries, speakers, guests, and participants for being a part of this meaningful celebration. With gratitude and reverence, let us carry forward the legacy of Charaka. Thank you and have a wonderful day. Thank you all.
Thank you.